Assalamualaikum dear student, hope you all will be fine. Let's start today's lesson. It's chapter number 1, gaseous exchange part 3. In today's lesson, we will talk about the disorders of respiratory system in humans. There are a number of respiratory disorders which affect people. The percentage of such disorders is particularly higher in Pakistan due to the more concentration of air pollutants. Some important disorders are bronchitis is inflammation of bronchial tubes causing swelling and increased mucus production. It can lead to breathing difficulties and persistent coughing. Causes of bronchitis: it may be viral infections. Common viruses like the flu or cold are the main cause. Bacterial infection, less common but can also trigger bronchitis. Irritants such as smoking, pollutants, and chemical fumes can irritate the airways. Weaken immunity, vulnerable individuals like the elderly or infants. Persistent coughing, wheezing, chest discomfort, shortness of breath, low-grade fever, fatigue, sore throat, and nasal congestion are typical symptoms of bronchitis. There are two types of bronchitis: acute bronchitis, short-term, usually caused by viral infection lasting a few weeks. Chronic bronchitis, long-term, often linked to smoking or prolonged exposure to irritants. Emphysema is a chronic lung condition where the air sacs in the lungs are damaged, leading to difficulty in breathing and reduced oxygen exchange. Causes of emphysema: smoking, the leading cause, damaging lung tissue over time. Air pollution and irritants, long-term exposure to dust, fumes, or pollution. Symptoms of emphysema: shortness of breath, chronic cough, wheezing, fatigue, and difficulty in exhaling are common symptoms that worsen over time. By the time the symptoms of emphysema appear, the patient has usually lost 50 to 70% of his or her lung tissue. The level of oxygen in blood may get so low that it causes serious complications. Pneumonia is a lung infection causing inflammation in the air sacs, which may fill with fluid or pus, leading to breathing difficulties and other symptoms. Causes of pneumonia: bacterial infections commonly caused by Streptococcus pneumoniae, viral infections, influenza, respiratory syncytial virus, or COVID-19. Fungal infections, more common in people with weakened immune system. Aspiration, inhalation of food, liquids, or harmful substances. Symptoms of pneumonia. Symptoms include fever, chills, persistent cough, chest pain, shortness of breath, fatigue, and sometimes confusion in older adults. Treatment of pneumonia: antibiotic for bacterial pneumonia, antiviral medications for viral infection. Supportive care includes rest, hydration, and oxygen therapy. Asthma is a chronic respiratory condition where the airways become inflamed, narrow, and produce excess mucus, leading to breathing difficulties and recurring episodes of wheezing, coughing, and shortness of breath. Causes of asthma: allergens, pollen, dust mites, molds, or pet dander. Irritants, smoke, pollution, strong odor, or chemical fumes. Genetic, family history of asthma or allergies, infections, respiratory infections in childhood. Symptoms of asthma: frequent wheezing, shortness of breath, chest tightness, coughing, and difficulty breathing during physical activity. Treatment of asthma: medication, inhalers to manage symptoms, allergen control, avoid known triggers, lifestyle changes, regular exercise and breathing techniques. Emergency treatment for severe asthma attacks: seek immediate medical care. Lung cancer is a disease characterized by the uncontrolled growth of abnormal cells in the lungs, which can form tumors and interfere with normal respiratory functions. Causes of lung cancer: smoking, the leading cause due to harmful chemicals in tobacco; secondhand smoke, prolonged exposure to smoke from others; environmental factors, radon gas, asbestos, and air pollutions; genetics, family history may increase risk. Symptoms of lung cancer: persistent cough, chest pain, shortness of breath, coughing up blood, unexplained weight loss, fatigue, and recurrent respiratory infections. Treatment of lung cancer: surgery to remove cancerous tissue; radiation therapy targets and kills cancer cells; chemotherapy uses drugs to destroy cancer; targeted therapy focuses on specific genetic mutations in cancer cells; immunotherapy boosts your immune system to fight against the cancer. Smoking is harmful due to the chemicals in cigarettes and smoke. Tobacco smoke contains over 4,000 different chemicals, out of which at least 50 are carcinogens and many are poisonous. Chemicals in cigarettes: nicotine, highly addictive, affects the brain and heart; tar coats lungs, damages tissues, and contributes to cancer; carbon monoxide reduces oxygen in the blood, straining the heart; ammonia, benzene, and formaldehyde, toxic chemicals that harm organs and can increase cancer risk; arsenic and lead, harmful heavy metals causing toxicity. Bad effects of smoking include lung diseases. Smoking causes lung cancer, chronic bronchitis, and emphysema. Heart problem increases risk of heart attack, stroke, and high blood pressure. Cancers linked to cancers of the throat, mouth, esophagus, pancreas, and bladder. Other tissues: premature aging, reduced immunity, infertility, and poor wound healing. Passive smoking occurs when non-smoker inhales smoke from others. It can lead to similar health risks as active smoking. Children and pregnant women are particularly vulnerable. Preventive measure against smoking. Education about the dangers of smoking is essential. Support systems and resources can help individuals quit. Celebrating World No Tobacco Day on May 21st promotes awareness. Thanks for watching the video. Like the video, subscribe the channel for more videos.